I really want to de-influence you from taking all the supplements you see online. And I'm a naturopathic doctor. I use supplements all the time in my practice. I recommend them to patients, and I think they can do amazing things. But here's the thing I want you to know is when we are looking to treat something, we have to have a objective timeline and an outcome, because I'm often seeing patients who are, first of all, overwhelmed with the amount of information they see online. They don't know how to navigate the different options they're seeing. This supplement looks good for this and this looks good for that. And, creatine is going to help their brain fog and this is going to help that. And so when they see me, they're taking a multivitamin, a greens powder, or collagen. They're taking vitamin D, vitamin C, magnesium, right? And they are overwhelmed and they're struggling and their concerns are not being solved. And so one of the biggest uh, pieces of my job as a naturopathic doctor is to understand what is the root cause of what's going on. And I look at this from a number of different perspectives. One of the biggest things that I treat in my practice is perimenopause and menopause. And part of that is having those HRT, those hormone replacement therapy discussions. And the problem is with perimenopause and menopause and hormone replacement therapy is there isn't one test that identifies that perimenopause is in fact going on. There isn't one test that identifies that somebody would be a good candidate for menopause hormone replacement therapy. It's ultimately a discussion. And sometimes people don't like that answer because it gives them a lack of objective data to go off of. It gives them this, wait, why are we just, throwing it out and letting whatever else decide, right? It feels like it's less concrete. And a lot of times that conversation about it being less concrete can feel dismissive to patients. They're used to being brushed off. They're used to being told that their experience is not real or that they should just figure it out. And one of my roles is to say, okay, here's how we can understand what's going on hormonally. Here's how we can understand if hormone replacement therapy is, in fact, a good strategy, a good tool for you. But I really want people to understand that it is not the only tool. And as far as supplements are concerned, I think it's way more important to understand what else might be going on that can contribute to how you're feeling before we dive into treatment plan A, B, C, or D. And I'll give you an example. Patient will come see me, 37 years old, convinced she's in perimenopause. Periods are still regular, but she gets hot flashes and night sweats, particularly in the second half of her menstrual cycle leading up to getting her period, those 2 weeks. Maybe she gets menstrual migraine, she gets mood swings, and she's getting, low sex drive, vaginal dryness, heart palpitations. And she is like, this has happened all of a sudden. It is perimenopause. The reality is, when we look at it statistically speaking, someone who is before the age of 45 is less likely to be going through perimenopause and more likely to be going through those late reproductive years. Now, there are different stages. Typically, we're looking at bleeding as our main indicator of what is going on. Now, does it mean that this patient should not be on HRT? No, we have to have a full conversation. We have to understand, is this person in what we refer to as premature ovarian insufficiency? Basically, did her ovaries stop working earlier than we anticipated? And if that is the case and she has no hormones, typically she wouldn't have a period. And then we want to look into reasons why she wouldn't have a period. And if premature ovarian insufficiency or early menopause is the reason, hormone replacement therapy is absolutely first line, the tool that will make her feel better and the tool that will reduce the risk that she now has. Because if you go through menopause early, you're more likely to have bone issues, cardiovascular issues, brain health issues, etc. And so that's one look at it. But why are all of these women having all of these symptoms? And, online, I love how we're opening the conversation and talking about perimenopause more and more, because women, decades ago used to just have to deal with it and put up with it. And I'm loving that we're more open to these conversations. But I still feel that we need to make sure that we're crossing our T's and dotting our I's, because there is no test that identifies you, person over here, are in perimenopause, and you would be, the first next step for you is hormone replacement therapy, right? Or you're in perimenopause and we're going to treat it like perimenopause. And I think it's important to push away from that and also look at all the other pieces that can be causing symptoms. The thing is, with perimenopause, the symptoms are non-specific, right? Symptoms are non-specific. And when symptoms are non-specific, we have to make sure that we're looking at all of the reasons why those symptoms can be happening. Think about brain fog, for an example. Brain fog is often due to hormonal changes in perimenopause, that tip of the tongue syndrome, that inability to focus, can't catch your words. If you are someone who's previously been diagnosed with something like ADHD, that might feel worse for you at that time. But we also have to understand that thyroid can cause brain fog. Low iron, I think, is the most underrated thing that so many women struggle with. And low iron is very important, not only to thyroid function, but also to day to day function, right? Your ferritin level should be much higher than we think it should be. And we can feel brain fog at a low level of iron, at low iron stores. I think that's important to understand. Oftentimes, patients come to me, they're like, I've had a lifelong of low iron. It's definitely not low iron. For sure, but it can be a combination of a lifetime of low iron and subtle hormonal changes, right? We can have things pile up. A lot of times, women in their late 30s, moving into early 40s, are having higher stressors. We're having the increased stress of life. And we're potentially dealing with children and parents and partners and high pressure jobs, right? And we cannot rule out the impact of that on our functioning. A lot of the times, and I don't want to say this to be dismissive of concerns, but I'm often asking patients, are the foundations being met? And I'm not saying, again, a lot of people will hear what I'm not saying, but I'm not saying that if you're sleeping well and exercising and, meditating, your perimenopause isn't going to happen. That's not what I'm saying. But I am saying that a lot of people I speak to have not managed their stress, are not sleeping, are running on 3 coffees a day and forgot the last time they had water, are not consuming enough fiber, are not intentionally moving their bodies. And so I think it's really important to understand that the ovaries are very sensitive to the environment that we put them in. The ovaries are very sensitive to metabolic changes, insulin resistance, inflammation. The ovaries are really sensitive to that stress system, the stress on the HPA axis. And the way I describe it to patients often is that we get to a point where, our body is, you think about it being young, your kids fall and they hurt themselves and they get a bruise and they bounce back and they get right up. And then, you're 35, you're 40, you're older, you have that same fall, you break a bone, right? The body becomes less resilient in a lot of ways. And so it can be the fact that you're struggling with other issues that are compounding on top of that really fragile hormone system at that age. And that's causing perimenopause like symptoms. And so, am I saying that we have to tough it out? No. I see the sentiment online that you just have to wait till it's bad enough, or I went through it, so you should have to go through it. And that's not what I'm saying. But I also think, like anything else, we need to have a conversation. The conversation is nuanced. We need to look at your goals. We need to zoom out and we need to see what contributing factors can be leading to the way you feel. And then we create a treatment plan using tools like we normally would, right? One of those tools might be hormone replacement therapy. For some people, it might not be. For some people, we say, you know what? It's your thyroid, your iron, and you could probably use a little bit of hormones, and that's okay. The individualized plan is the best plan that gets you to the outcome that you're looking for. And when it comes to supplements, when you are taking a number of supplements and you still feel crummy, it is time to go back to the drawing board. Supplements have a time and a place, and it's important that we do things in the right order and that we have proper goals that we're tracking and working our way towards so that we can get the best outcomes with your care.